Let's turn now to our health spotlight and welcome in Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams. First of all, hello. How are you doing?
I am well. Good to see you.
Good as always to see you. Let's begin with a report yesterday. Only 6% of doctors in the United States are Black. The concern is that a lack of diversity in doctors can actually harm patient care. How big is that concern and what does it mean for patients?
Well, the study just reaffirmed what we've long known, particularly for Black males. There are fewer going into medical school now than what there were in 1978. And this is not just an ethical, a moral issue. It really does impact patient care. Studies consistently show that people are taken better care of and are more responsive to their healthcare providers when they can relate to them. If you're someone who is differently abled, then that means someone who has a disability can relate to you better. If you're from a rural community, you relate better to a rural doctor. And if you're African American, studies consistently show that you have lower infant mortality rates, you have better outcomes, you're more likely to take advantage of treatments if you're being taken care of by an African American or Black doctor.
So how do we change that number? Is it college tuition help? I also know you've helped with the Black Men in White Coats, the organization that works to get young African Americans interested in medicine.
Well, we need more research into how we can improve the pipeline. Some of it is tuition assistance because, quite frankly, it's expensive to go to medical school. It's a daunting task, but that alone is not enough. You can't just give someone money and say, hey, you go for it. And I'm someone who's personally been fortunate to be able to be a part of pipeline programs where they provided me not only a scholarship, but also academic and social support when I was on campus. So there was the Meyerhoff Scholarship Program that I was in when I was an undergraduate. Eli Lilly gave me support when I was in medical school. We need holistic programs like that look not just at the financial need, but at the social supports and the academic help that sometimes people need to be successful to get them across the finish line. We also need to show them role models. You've got to see it to believe you can be it.
Sure. Okay. We also saw this week new talk about the FDA turning to memes and YouTube to help fight medical misinformation. Is this the role the FDA should take? Can an agency seen as bureaucratic help stop the spread of fake medical news on the internet?
Well, I've talked a lot with FDA Commissioner Rob Califf about this, and it's a challenge because you want your government agencies and officials to act like traditional government agencies and officials. And as Surgeon General, I struggled with this because the majority of people get their medical information online. So you've got to be online to get what you want positively out there and to combat misinformation. And Dr. Califf said at a recent hearing in Congress, something that I believe to be true. Almost nobody should be dying of COVID right now. Between vaccinations, boosters, and treatments, if you get all three, you shouldn't be dying of COVID in most cases. Almost all these deaths are preventable, but people aren't getting the information or they're being scared away by misinformation. And that's not just COVID. That's an array of treatments that are available out there that people are being dissuaded from because of misinformation. So we need to take this on. That's what the FDA is doing. I think it's the right thing for them to do, to be where the people are. But they've got a credibility problem, and they've got to build up their credibility again. They've got to streamline and correct mistakes that they've made in the past, and Dr. Califf is doing that. And again, sometimes it's YouTube, sometimes it's TikTok, but a lot of times it's making sure local doctors have the information they need to actually be able to make good recommendations to their patients.
Okay, just a few seconds left. I do want to touch on a big headline, our neighbors to the east, the train derailment in Ohio. Is there a threat to people in Indiana from either the chemicals released in the air or the water that you see?
I actually talked to a CDC official about this today, and they said that they're doing a good job of actually monitoring the situation. And right now, there is absolutely no reason for people in Indiana to be concerned. But we're just going to have to stay posted. The problem is once these chemicals are out there, it's hard to contain them, which is why you want to prevent a disaster like this instead of treating it. But I've been assured that, again, they're on top of it, and they're going to continue to keep us updated.
Okay, good to hear, and good to hear from you. As always, Dr. Adams, thank you.
Great to see you. Thank you.